Hi, I'm Steve Adubato. Welcome to a very special program where we look at childcare. Childcare, if you will, in the age of COVID-19 now and in the future. We're taping in the middle of May. This program will be relevant for a long time after that. Um, we've been looking at these issues for a long time, but they've never been more important. And we're honored to be joined right now by someone who's talked to us about this many times in the past. She's Kay Hendon, Senior Program Officer, the Nicholson Foundation. Kay, good to see you.
Nice to see you, Steve.
By the way, let everyone know what Nicholson is and why it matters when we're talking about childcare.
Well, the Nicholson Foundation has always focused on the most vulnerable populations in the state, and our current areas of emphasis are healthcare and childcare, early childhood. So those are two things that are of such high priority, even more high priority right now. So we're very glad to be able to be in the mix and do what we can as a foundation to try to help address what's going on right now.
And there are two initiatives, our longtime right from the start NJ initiative we've been involved in, and also the PNC initiative, Grow Up Great. The issues that both entities are concerned about, both initiatives, frankly play out here. And so one of the first questions that I know that you've been thinking about is home-based childcare. What is it and why is it, again, more significant than ever before as we do this program?
Well, we've been thinking about it a lot. We've been involved with it over the years quite a bit. But home-based childcare is what some people call family childcare. It's when someone cares for a child in their home. And in New Jersey, if you care for children in your home, you're not required to be regulated in any way unless you're serving a child that is getting a subsidy through the state, a low-income family that's getting a subsidy to help pay for the childcare. So in New Jersey, we have a lot fewer family childcare providers or home-based providers than we would like. The numbers have been dropping here as they have been nationally over the last several years. They've dropped from, I think what we have here, over 5,000 providers in 2001. Now we have just a little over 1,000 providers in New Jersey. But these providers are serving maybe about 10,000 families who need care. They can take up to 5 children, each provider in their home. And they really are a mainstay for many workers. Right now, we're especially interested in this kind of care for a number of reasons. And one is that a lot of our essential workers, what we call essential workers, whether they're working in a grocery store or directing traffic or working in a hospital, they need care at second shift and third shift. So even the emergency child care centers, the centers that have been approved by the state, are not open on those schedules. And they also aren't able to serve families that need a flexible schedule. So maybe I'm assigned to work 3 days this week and only 1 day next week. Centers don't provide care that way. But the home-based providers, because it's a less formal kind of system and they are caring for fewer children, have in the past had that kind of flexibility. And we think that parents are turning to them more now when they're just stuck for what else am I going to do? So those are just some basic reasons why we're talking about it a lot. But I could talk to you a little bit more about where we could see this going in the future when we talk about what are we going to do when half of our childcare centers don't come back into operation after this is open, and when we have a lot of new rules requiring them to serve fewer children with a lot stricter health and safety guidelines. Even though they're pretty strict as it is, it's going to be much more strict as they reopen. So we are not going to have very much childcare or as much childcare when we start getting back to normal. We don't know if the workers that have been working in childcare are going to come back.
That's right.
So home-based care is a way to maybe help us get back and maybe even build back better, as we're saying.
Okay, let me follow up on this. In many ways, what you're describing, and we've talked to others in this field who understand it really well. Childcare is changing forever. It isn't when we get back to a normal. There'll be some new normal, whatever that means. But childcare, the definition of it, how it plays itself out, the number of childcare centers, all of that's going to change dramatically for the next forever.
Right.
Let me ask you, I'm curious, to what degree is that a responsibility of government? Because your foundation has been very involved. The Terrell Fund's been involved, as I mentioned, some private corporations as well. But is this a governmental public policy role as well?
We really think it is, Steve. the whole economy of the state, of the country, relies not solely on childcare, but largely on childcare because people simply can't go to work if they don't have
That's
childcare.
right.
And we recognize that people are going to be going back to work gradually here. But if there's no childcare and if it's not when they need it and where they need it, they cannot work. So it's if only for that reason, it is a government responsibility. And sad to say, before we came into this crisis, childcare was operating on a thin edge. As you know, you've heard us talk about this, but there's never been enough revenue or enough attention paid to childcare to really give parents the services that they need so that they can have a solid family life and a work life and not have to worry about what's happening with their children during the day when they're at work. So yes, it's going to come back in a very different way. And that's one of the reasons we're talking more about home-based care, because we certainly want all of our centers to come back as many as we can possibly get. But
some won't, some will not.
Yeah, a home is an easier place to open up a new care place. We've talked a lot about what some other states have, which is you can call them mini centers or home-based centers, but home-based group family childcare, but where there are two adults in the home all the time, which would allay some parents' fear about family childcare, and which would allow them to take more children and to have a more center-like, if you want to call it, kind of care, to work more on the quality, to serve more families, to be even more flexible. So there are other models out there for this home-based care that we think we might be able to build on as we try to bring back a better structured and more stable and more responsive childcare system for parents and for children.
Before I let you go, though, I got a minute left, Kay. All that has to be done in a way that is safe and protects our children as best we can, and that's not cheap.
It is not. And just quickly, I want you to know that just in the last several months, new restrictions have been put upon family childcare. There has been a criminal background check for the family childcare providers. Now there will be for everybody who lives in that home and also for the substitute providers. So that raises a lot of questions about whether we're going to lose even more home-based providers. So yeah, we need more attention from our state. And I know that our state is looking at it very carefully. I think we're one of only 3 states in the whole country that doesn't require regulation of family childcare providers unless there's a publicly funded child in that program.
Okay, I promise you this. The last time we talked, we were in Vermont at a national conference that the folks at the Terrell Fund put together and others, and the Nicholson Foundation has been right in the middle of this. I promise you we will continue this conversation, will not be the last. Hopefully we'll see each other in a studio, but if not, we'll keep talking remotely. But most importantly, thank you to you and your colleagues at the Foundation for all you're doing. Thank you, Kay.
Thank you, Steve. I know you're going to stay on this.
We will. I'm Steve Adubato. We'll also be right back right after this.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by PNC, Grow Up Great, the Turrell Fund, supporting Right from the Start NJ, Atlantic Health System, New Jersey Sharing Network, the Northward Center, the Healthcare Foundation of New Jersey, the Fidelco Group, Guarini Institute for Government and Leadership at St. Peter's University, and by Choose New Jersey. Promotional support provided by the New Jersey Business and Industry Association, and by New Jersey Monthly. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.